Nervous about your first dental visit? Here's exactly what's going to happen, moment for moment, step by step. First, when you come to our office, you're going to be greeted by our wonderful front office staff. After you fill out some paperwork, my friendly hygienist will come out, greet you, and bring you back to the operatory. The operatory is the room where dentistry is done. And so once you're back there, we will then take a full series of x rays. After x rays, I'll step in, we'll do a comprehensive exam. Along with that comprehensive exam, we're going to do a periodontal evaluation to evaluate your gums. The reason that's important helps me to understand the health of your gums. Helps me understand, do you have healthy gums? Or do you have gums that are in a state of disease, known as gum disease or periodontitis? And depending on where you fall, we're going to tailor your treatment perfectly for you to get your gums back to an optimal state of health. Along with your exam, we're going to use something called an iTero. It's like a little small video camera. And we'll place that inside your mouth. And that helps me to show you what I see whenever I look inside your mouth. It's very educational. It's a lot of fun. Also, along with our x-rays, we have AI. AI overlays the x-rays, helps us to make for sure we're not missing a thing. That way, whenever we provide you with the condition of your oral health, you can be assured that condition is exactly properly diagnosed accurately to you. That way, we are able to provide you with the best treatment possible. You brush your teeth every day. So why is that hard buildup still there? Well, I'm going to actually tell you the science behind what's going on. You see, when we brush our teeth, we all follow into habits and patterns. Sometimes on the upper right side, maybe you brush even better than you brush the upper left side, or vice versa. So there may be some areas that you are consistently brushing well, but also some areas you're consistently missing. In those areas where you're missing, you have plaque, that film that builds up on your teeth. And if it's not removed within 14 days, it mineralizes to become tartar. Tartar is also called calculus. It's a hard mineralized substance. The best way to describe tartar, it's like a mineralization that builds up around your sink. If you can imagine, you can't just take a sponge or washcloth and move and remove that hard mineralized deposit on your sink. You've got to more scrape it off. Tartar in the mouth is very similar. It's hard and it's attached to your teeth, and so it requires special instrumentation to remove it. And the purpose of removing that tartar is that tartar acts like a nest for the bacteria that's in your mouth. So if tartar's there, the bacteria is there. If bacteria is there, the gums become inflamed and swollen. If the bacteria stays there long enough, you start to have bone loss. As you lose bone, you are losing the supporting structure of that tooth. So over a long enough period of time, you'll lose enough bone that eventually the teeth become loose in their sockets, and then the end fate of gum disease happens. You lose your teeth. We don't want that to happen. We want to make sure that we treat you right. That way you keep your teeth. Ever wonder why your cleaning took twice as long as your friends? Well, here's what is going on and what's actually happening. No two mouths are the same. Let's pretend you own a car wash and customer one brings you their car. It is pristine, just a little light dusting. That's all it's there. It takes you no time to make that car look brand new, perfect, like you just drove off the showroom floor. They have a second customer. Well, that person hasn't washed their vehicle in like 3 years. And beyond that, this customer lives down a dirt road and it's been raining the last 2 weeks. So you have caked on mud on top of 3 years of road grind. And you know it's going to take you a lot longer with precision technique, better materials, specialized instruments to get that car looking amazing again. Same thing's true in dentistry. One person may come in, they have meticulous brushing technique. They floss every day. They use a water pick. Well, it won't take us long to get that person's mouth clean. A second person, well, maybe they're kind of like that dirty vehicle. They haven't been to the dentist in about 3 years. They have a lot more buildup in their mouth, and it would just simply take a little more time to treat that person to get their mouth looking amazing as well. So that's the difference. You hear those numbers all the time when you're here for a hygiene exam. One, two, three, four. What do they mean? Well, let me tell you what they mean and what it's for. What we're doing is we're measuring the pockets of your gum line. In a healthy situation, the pockets of the gums should be shallow, 1, 2, 3 millimeters, no bleeding, no puffiness, no soreness. Whereas some patients, those pockets may be much deeper, 4, 5, 6, 7. That just means the deeper the pocket, the more difficult the cleaning for us to perform because we want to perform the right cleaning in the right way to get you back to an optimal state of health. Kind of like this. Pretend you have those designer jeans, with those little bitty pockets that are thin, and you just swipe your finger through, and those pockets are empty. That's like a person with a healthy gum line compared to someone with like cargo pants. Big, deep pockets. You stick your hands in there, half your arm in there. You reach around in there. Heck, you find the keys that you lost last week in there. You find gum wrappers and a fistful of mints. Just a lot more things can accumulate in those deeper pockets. That's like a person with gum disease. The deeper the pocket, the more bacteria, the more biofilm it's down in that pocket, which causes more inflammation. More inflammation causes bone loss, and if not treated, after you lose enough bone, you'll lose your teeth. We don't want that to be your fate. Come on in and see us. Let's diagnose you properly. Let's get your gums healthy. If your cleaning hurts, don't just suffer through it. Here's what the pain is telling us about your gum health. Whenever a cleaning hurts, that means you've got a lot more inflammation in your gums. That means there's a lot more bacteria in your gums. And that's the reason your gums are so tender. Have any of you ever jammed your finger? That finger, when it's jammed, it's got lots of inflammation around it. Even just to hold a pen or a pencil, it hurts. It's because of inflammation. The same thing's true when you have inflamed gums. Even though we're being gentle and cleaning, the inflammation is the reason the cleaning's a little tender. And if that's the case, let us know because we have ways of making it comfortable for you. Come see us, Colon Gentry Dentistry. We can see buildup with our eyes, but x-rays show us something totally different. And here's the answers. Whenever we look in your mouth, we can see tartar above the gum line. But with x-rays, we can see what's going on below the gum line. Below the gum line, sometimes tartar forms there, but also you could have bone loss. But we never know that until we take x-rays. I used to lecture a lot to kindergartners and first and second graders during Dental Health Month. And what I would always tell them is x-rays allow me to be a little bit like Superman. Do you remember from the cartoons of Superman? He could see through walls with this x-ray vision. Well, your gums are like a wall. I can't physically see through them, but with x-rays, I can see everything going on. That way we can understand your full oral health and provide you with the best treatment to keep your gums healthy. Remember, gums are the foundation of your teeth. Healthy gums mean you're going to have healthy teeth. If you have sensitive teeth and you're dreading your cleaning, hey, come talk to us because we have ways of making it comfortable. That way you can get the cleaning that you need, the cleaning that's going to bring your mouth back to a perfect state of health. If you're tender, just let us know. We have methods like topical anesthetic, which looks like a jelly, and we just paint it over the gums. It penetrates through. That way the gums are not tender while we're providing the treatment that you need. Still yet, if you have teeth that are sensitive, maybe the jelly isn't quite strong enough. We have other ways of making you comfortable. We can give you local anesthetic. Here at Colon Gentry Dentistry, we're very compassionate to your needs, and we're going to make for sure that if we have to give you local anesthetic, we do it in a very gentle manner. Once that local anesthetic absorbs in to your upper and lower jaw, then your teeth are going to feel numb. Your tissues are no longer going to feel tender while we provide the cleaning that you need. We just want to make sure that we do a perfect job for you because we love you here at Colon Gentry Dentistry. Most people don't know this, but what you do 24 hours before and after your cleaning can matter and ultimately bring about better oral health. You see, a lot of times patients are thinking, I got to go in for a cleaning. Maybe I need to start brushing harder. Maybe I need to start flossing more. Maybe I need to use a water pick. What my suggestion would be is use your normal technique before you come in to see us. But once we clean your teeth, once we get the plaque, the tartar, the bacteria off your teeth, the next 24 hours, I want you to do one special thing. I want you to go home, whatever that old toothbrush is you have at home, whether it be a handheld toothbrush, whether it be an electric toothbrush with a head on it, throw away the old toothbrush, throw away the old head. Put a brand new head on the electric toothbrush or get yourself a brand new handheld toothbrush because we don't want you using the old toothbrush. The old toothbrush has all the old bacteria that we just spent time cleaning out of your mouth. We want you to have a healthy mouth. So once we get you cleaned up, start off with a brand new toothbrush. There you go.